Y'all, we got to talk about it. I don't know if you guys know, but they're saying that the Hanta virus, the rat virus, it is spreading. Okay. It is spreading. And people are saying this is done on purpose. Now we got the Ebola virus. And going back to the rat virus, you know it's going to be worse than HIV. They said the Hanta virus, it can be passed on through you know what. And in a man's you know what start with the C, and then the man and the nuts, it lasts 6 years. So you can infect a lot of women. You know what I'm saying? So people, I don't know, honey. I would have thought if it lasts in a body for 6 years, I thought it would kill you. I thought you would die after 2 months. So I don't know how that's working. How is this staying inside your nuts for 6 years without killing you? I don't know. But they are saying that the Ebola virus is back on full demand, and it's another strand that's worse. 6 Americans got it, and it's coming here to America. People are saying it's all pre-planned. So I want to give you guys some videos to watch that's more educated, and that's going to let us know what's going on. Make sure you guys like, share, subscribe here, and let's see what these people got to say.
Governments around the world are spreading the hantavirus so that it can spread globally before they have a lockdown. They're going to lock the world down again, this time ahead of nuclear Armageddon. That's what's coming. Hantavirus, global lockdown, nuclear war. It's coming, and it's too late to do anything about it. God loves you. I love you.
This is important news. The CDC and news outlets report that an American who is working in the Democratic Republic of Congo has tested positive for Ebola. That person also has symptoms. Also, six other Americans rather, who are close contacts of that person who has tested positive, also in the Democratic Republic of Congo, are being monitored. So the CDC has released this information. 7 people total, 1 American tested positive, 6 other Americans have been in close contact. The CDC states that they're working to transport all 7 Americans to facilities in Germany where they will receive care, be evaluated, etc. And all of these individuals were exposed as part of their work in the Democratic Republic of Congo. Now, a couple other things that you really should understand. The CDC also has just said today that the U.S., the United States, is restricting entry for non-U.S. passport holders who have been in Uganda, Congo, or South Sudan in the past 21 days. In other words, there are some travel restrictions being placed by the CDC and the government. Please, if you travel a lot, please make sure you stay up on any travel restrictions via the CDC, etc. The CDC does go on to say that the immediate risk to the general U.S. public is low. Also, and this I think is a really important point, the CDC states if you've traveled to countries affected by Ebola, you really need to monitor yourself for symptoms. And if you come down with any symptoms, you need to seek medical care right away. But you also need to be very upfront and direct about what your exposures have been as you are seeking medical care.
We have a big Ebola update this morning. At least 6 Americans in the Democratic Republic of Congo have been exposed to Ebola, with several cases being, quote, high risk, according to STAT, which reported this first. 6 people were exposed. 3 Americans have been deemed, quote, high-risk exposure. And according to Stat News, one of them may have developed symptoms, though there's no confirmation that any of them actually have the virus as of this post. Stat and CBS are now reporting that the United States government are working hard to evacuate these 6 Americans from the Congo to outside of the country, possibly to a military base in Germany for treatment and quarantine. The threat to the United States of America is extremely low. But this is a very serious situation for those in the Congo, in Uganda, and in surrounding areas, because this is a strain of the Ebola virus that doesn't have a treatment or a vaccine. There are now 350 suspected cases, over 90 deaths, and it could become a much larger outbreak because of how long it went essentially uncontained and unknown to the public. So I'll have more updates for you soon. Spread the word, follow for more.
I don't know why TikTok doesn't want this information to come out, but the last video I reported about when it came to the Ebola outbreak in DRC and Uganda got hit with a violation. No specific violation. I fought it, and they gave it back to me. And then an hour later, they took it back. So I'm disputing it in a ticket. Here's an update. 6 Americans have been exposed to the Ebola virus in Congo. Yes, 6 Americans. And this is according to Reuters, Yahoo, CBS News, BBC, and the New York Post. Now, according to multiple news stations, 3 of the Americans faced high-risk contact or exposure, and 1 was symptomatic. It wasn't immediately clear whether the Americans are still in Congo or not. I want to remind y'all that 80 people have lost their lives in Uganda and the Congo over this Ebola breakout. Now there's more than 300 suspected cases. Now the CDC says at this time, the risk in American public remains low. And the health agency has issued a travel advisory for Americans traveling in Congo and Uganda. To practice enhanced precaution and avoid people who have symptoms. How the fuck are you supposed to know? At this point, keep y'all asses where y'all at. Now here are some of the symptoms. Fever, muscle pain, rash, headache, vomiting, severe weakness, abdominal pain, nosebleeds, vomiting. That could be the flu. That could be a stomach virus. That could be multiple things. But I don't want nobody to panic.
Okay, guys, we need to have a little conversation about something that's happening right now in Africa, okay? And yes, it matters to you. Even if you're sitting right here in America, you could be in Atlanta, Chicago, Houston, Compton, it doesn't matter, okay? This matters to you. Africa's top public health officials just confirmed another Ebola outbreak, this time in northeastern Democratic Republic of Congo. 246 suspected cases, 65 deaths so far, and 4 of those deaths are lab-confirmed Ebola. Now, before you scroll past, stay with me, because history is trying to teach us something, okay? This is Congo's 17th Ebola outbreak since the virus was first identified in 1976. 17 times. And every single time the world watches from a safe distance. We won't keep doing that until you can't do it anymore, all right? So here's what you need to know. Ebola spreads through direct contact with bodily fluids. It attacks your body from the inside. Severe gastrointestinal distress, unexplained bleeding, and depending on the strain, the fatality rate can range from 25% all the way to 90%, okay? Now, here's the part that should make each one of us sit up straight. The strain currently circulating in Congo is not the Zaire species. And the Zaire species is the only one of 4 known strains that has a licensed vaccine. So what they got going now ain't it. That means right now in 2026, they're fighting an outbreak with early detection, contact tracing, and isolation. That's it. No vaccine, no cavalry, and contact tracing is going to be a serious challenge. Why? Because people regularly cross into Uganda and South Sudan for mining work or to get away from violence from insurgent groups. Borders don't stop a virus. Neither does poverty. Neither does war. So why does this matter to you sitting safe in America? It matters because we live in a connected world. Because viruses don't check passports. Because we watched COVID teach us the hard way what happens when we dismiss over there outbreaks until they're sitting right there staring you in the face on your doorstep. And because this administration has been gutting global health infrastructure, pulling funding from the very agencies and early warning systems that caught these things before they spread. When the world loses its ability to detect and contain outbreaks at the source, we are all of us, at a greater risk. Full stop. We don't have the luxury, y'all, of pretending the rest of the world is not our business. All right? We tried that before. And we know how that story ends, tragically. Now listen, I'm not fear-mongering. And knowing this, having this knowledge is not fear, it's power. Stay informed. Stay vigilant. Protect yourself as best you can. Read up on it. And please share this video with somebody that needs to hear it. Stay safe out there. Take Take care of yourself. Take care of each other.